Good evening, all. Welcome to this webinar. I'm your moderator, Preeta Harikrishnan, Deputy Manager, Admissions, Amrita Health Sciences, Kochi campus. I'm glad to have you all today with us. You will be content to listen to the webinar on the scope of optometry as a professional course. I'm sure you will benefit a lot from this webinar. And to make sure we are helping you the best, we have the chat box to send your doubts. The doubts will be cleared towards the end of the session. So to begin with, let me introduce to you Madam Grishma, KG, Department of Ophthalmology, Amrita Institute of Medical Sciences, Kochi. Madam completed her BSc Optometry from Amrita Institute of Medical Science and Research Center, Kochi, and her MSc Optometry from Rayan College of Optometry, Adapal, Thrissur. Grishma Madam has long years of experience as BCVA technician, refractionist, clinical optometrist, and presently also working as faculty for BSc Optometry course at Amrita Institute. I welcome you, Madam, to address our viewers. Grishma Madam.
Hi all.
Yes, you may begin, ma'am.
Okay, sure. Good evening all. I'm Grishma, optometrist at Amrita Institute. I have been here for the last 7 years. I'm a teaching faculty in BSc Optometry course. Today, I'm glad to hear to explain BSc Optometry course and visualizing the future, a glimpse into optometry is promising tomorrow. What is optometry? Optometry is a healthcare profession concerned with the eyes and related structures as well as vision and visual system and vision information processing in humans. We all know that eye is an important part in our life. Without eye, we can't see anything. So in optometry, we will learn more about eye. And what is optometrist? Optometrists are primary healthcare practitioners of the eye and visual system who provide comprehensive and vision care, which includes detection or diagnosis and non-surgical management of ocular diseases, refraction and dispensing and rehabilitation of conditions of the visual system. The optometrist and ophthalmologist are different. We are the backbone of the ophthalmologist. So we provide the vision for every patient. We find out the abnormalities of the patient and we provide proper treatment and proper treatment like glasses and all. We provide dispensing and rehabilitation like vision if the patient is need more rehabilitation methods like the patient is have low vision, we will give them the rehabilitation of the system. With different types of rehabilitations are we will study in this optometry course. And what all are the duties of optometrist? Optometrists do the routine eye examinations and they will diagnose and therapeutic procedures, prescribe glasses and contact lenses and other visual aids. The health education at community level, like we go for the medical camps and all, we educate the people around the area and we will give the explanation and we will give the eye care importance to that patient and then we will do the occupational and industrial eye safety. Then we educate the patients on proper eye care and may participate in research or teaching. Refer patients to certified ophthalmologists when they require more holistic eye care. And why optometry in AIMS? In AIMS, we implemented the national curriculum in 2023. After that, we continued a semester system. In our BSc Optometry courses approved by Kerala Paramedical Council. We provide structured and detailed theory classes, qualified and experienced faculties, and we maximize our exposure with the patient in our clinics and the medical camps and all. Availability of most modern technologies and equipments are providing, and the important thing is we give the higher percentage of placements in optometry, because we start the optometry in 2019. From 2019 onwards, brilliant students are selected as an optometrist in this hospital, and still it's continuing the process. From 2023, the strength is less. It's about 4. It's only the 4. Then now it's increased to about 15. And then I will explain the course structures. We all know that this is a 4-year course and 3-year plus 1-year internship. Before that, before implementing the national curriculum, we are following a 1-year course per year-wise course. But after that, we started the semester system, like 8 semester total. Like first year, second year, third year, then 1 year is compulsory internship. The first 6 semesters include the examinations and all. The last 1 year, clinical internship or the clinical program is conducted. And every semester contains 8 subjects, except internship. There is no exams in internship. Only 3 years, we have to study only 3 years. After that, 1 year compulsory internship. And the medium of instruction is English. English shall be the medium of all subjects. And eligibility criteria for this course is pass in +2 with 50% of marks in physics, chemistry, and biology. And in optometry, what do we learn? Basically, the optometry course is typically covers a wide range of subspecialties. Like we start with general human anatomy, then physiology, biochemistry, ocular pathology, ocular pharmacology, ocular biomicroscopy. And after the following semesters, we continue to geometrical optics, visual optics, and optometric optics. Rather than this clinic, we go for the English and communication, nutrition, medical psychology, and all. We are providing a teaching method like this. The theory classes, lectures, we will provide lectures class for all subjects, and we do assignments every week. And there is a seminar presentation for each students. Then case discussion. They can discuss all cases which they have seen in the OPDs, like in clinics. Then other is journal clubs. They can they will get more information about different kinds of journals and all. And there is a clinical conference in every year. Then practical classes. Practical classes is important in Amrita because there are lots of optometry colleges are here. But in Amrita, we provide more importance in practical. The students can demonstrate and hands-on training sessions will give, and the clinical posting in various subspecialties. In the ophthalmology, there is a subspecialties like in operation theater, optical manufacturing, optical shops, and we have lots of subspecialties. So they will get more posting and clinical posting in these subspecialties. And in examinations, sessional exam in every semester. In 6th semester, there is a sessional exam in every semester, and one pre-university and university examination at the end of each semester. 70% of attendance. The physical presence is mandatory in each semester. And pass criteria, 50% in each subjects. Then internship, like 1 year internship, 2 semester, like rotational posting in subspecialties of the ophthalmology. In ophthalmology, there is different sections are there. In refraction, pediatric ophthalmology clinic, like a children clinic, and cornea clinic, retina clinic, glaucoma clinic, squint clinic, low vision clinic, LASIK clinic, contact lens clinics, etc. These all are the structures of cornea, those structures of the eye. So we divided into different parts and we can have the clinical posting in these areas. And I will show you some optometry practical procedures here. This is the basic vision testing. We all know that this is the basic, before driving license and all, we do this testing. And this is another method. You can see this, our student is doing the procedure. So from the first year onwards, we are giving practice on these all equipments. We have all the advanced techniques here. These all are the procedures we do. This is the contact lens. We all know that what is contact lens. This is the contact lens fitting method. These all are the scanning and all. This is the instruments used for the low vision patients, like the vision is the patient with the low vision. This is, I'm introducing our consultants. These all are the consultant ophthalmologist in our department. This is Dr. Gopalas Pillai, HOD of our department, and Dr. Nadasha Radhakrishnan, and Dr. Anil Radhakrishnan, and Dr. Sujitra, Dr. Manoj Pradhapan, and Dr. Rehna. These are our backbone of the optometry department. And this is our optometry team. Actually, we have 10 members in our optometry team, and these all are, and she is the head of optometry, Mrs. Deepa. And this is our optometry students. Some of them are missing. And this is community ophthalmology. Like our students are doing their duties during their clinical posting. We are attending a medical camp outside the hospital. They learn more about from this camp. This is extracurricular activities. After the academics, we provide more participation in co-curricular activities. There is an inter-college competition and sports fest and arts fest, and lots of students holidays are providing in this institution. In this picture, you can see this. We won a competition on which is held in Rehan College of Optometry on behalf of World Optometry Day. And next, I will talk about some higher studies. After BSc Optometry, there is lots of options available here. After BSc, we can go for masters. With the masters, we can work as a lecturer or academic tutor in any institution. And MSc Clinical Optometry, we can specialize in clinical. Some of the institutions are not providing clinical posting in their institution. So they can opt for clinical optometry to more idea about the clinics and all. Then BSc Vision Science, Public Health. Masters in Public Health is also possible after completing BSc Optometry course. Then next is MBA. MBA is nowadays it is very important optometrists with the MBA. Some of the research people are interested to take optometry after completing the MBA. Then other one is the fellowship in specialized area, because in optometry there is subspecialties, so we can specialize some of any topic in the fellowship area. So fellowship will be in 6 months or in 1 year, and they will provide more clinics during the fellowship programs. Then PhD is also applicable after BSc. Then abroad. Abroad means United Kingdom and Canada. All we can go for a master's program after completing the BSc Optometry from Ahmedabad Institute. our 2012 alumni, she got an optometrist placement as an optometrist in UK recently, and one of the alumni from 2009, she got a placement at Ireland recently, and so we all have that possibilities after completing the BS optometry in Amrita. Next is higher studies in basics and applied science. Then job profiles or job designations will be after completing the BSc optometry, we can work as a clinical optometrist or the vision consultant. Vision consultant will be in the optical shop, and clinical optometrist will be in the academy, means in the institution or eye hospitals like. Then other thing is private practitioner. We can practice in our home or any other personal space. And next is lecture, professor or principal. These all are depending upon our qualification and experience. Then other thing is optometry researcher. After completing the optometry, we can go for the researcher in any pharmaceutical companies like that. Other thing is job opportunities. I will explain some job opportunities. Like we can work in this any of these areas. The first one is corporate sector. In corporate sector, there is lens manufacturing companies, and they can work in various eye-related pharmaceutical companies and the contact lens companies. And private sector means they can open their own optometry clinic with or without any optical shop. And other one is work for an optical chain under an optical store. The optometrist can work in an optical shop. Next one is public health. Public health means the public health centers we can work, or the medical colleges. But in medical colleges, we need a PSC. After that, we got the placement. Then a national government organization is also possible. The next one is the industries of companies. Here, there is multinational companies are providing multinational companies will do the preliminary examination, preliminary vision assessment, especially in the IT department. They do the preliminary vision assessment after getting a job. So they will provide a optometrist in their companies for checking the employees' vision status. And there is eye care hospital and institution. Every eye hospitals or institutions, we can work as a clinical optometrist or the academic tutor. Next one is the educator sector. Educator sector means faculty, we can work as a faculty depending upon our experience. Next one is scientific research. In scientific areas like any optical or contact lens research, we can go for that. Next is basic research and integrated profession. And finally, the optometry course, the important thing is there is no night duty. Sorry. There is no night duty in optometry. And after getting a job also, there is no night duty. Overall, the field of optometry offers a fulfilling career path and opportunities for professional growth and specialization and making a meaningful life in the future. So the individual quality of life will be better after taking the optometry course. So these all are the overview of optometry, and I wish we could meet early as possible. And thank you. Have a bright future ahead.
Thank you, Grishma ma'am. It was really very pictorial. The slides were really very clear and explanatory, and you could explain it well to them. I understand most of them who have attended this webinar have understood that they should really be going for optometry, and I hope they will also meet you very soon. And one of my doubts is, Madam Grishma, like what should our students, like once they are ready and they're coming to join optometry, what should be or how should they be mentally prepared for this particular course?
Because in our course we provide a orientation before joining the course, and here also the main important thing is there is no night duty, or every allied courses are providing night duties. And here before joining the course, you will get an idea after this session. And you there is mental um
Is there any stress
ability which the
factor? Like,
participant, yeah, stress factor is less in compared to all other courses. And we provide hands-on training after every theory classes, and they don't have any problem in the future. And uh, according to the suggestion, this will be a very good choice for you.
okay. So since last year, like I think now the curriculum has changed. Now,
Yeah,
is there a
yes.
lot of change? Like,
Like before that, ma'am, we used the year-wise system. Only one every year there is one pre-university and pre-university examination and all, and there is some two sessional exams are there. But now last year we started the semester system, so in that there is one sessional exam, one pre-university exam, and a university exam. And each semester there is eight uh, topics covered in each semester.
okay. So
And
so apart from theory, they'll be also having practical sessions side by
yeah,
side, even from
yes,
the
ma'am.
first year.
Yeah, yes,
Okay.
ma'am. First semester there is a basic practical. Then second semester also we start the practical, main
Okay.
practicals.
Okay. So thank you so much for spending such a lot of your time. So I'm expecting some questions from the candidates if they have any.
Okay.
Uh, I think if they could raise their hands or if they have any doubts, it'll be dropped in the chat box. Meanwhile, let me have Aishwarya who will explain to us about the admission process of this year. Ad- Aishwarya?
Thank you, ma'am. Am I audible, ma'am?
Yes, you're audible. Madam Grishma, could you just stop screen sharing?
So good evening all. I am Aishwarya KS from Admission Office, Amrita Institute of Medical Science, Kochi campus. So I am here to explain you about the admission process for the course Bachelor of Optometry for the academic year 24-25. So I will just share you the screen. So the duration of the course Bachelor of Optometry is 3 years plus 1 year internship. And the eligibility criteria is the candidate should be minimum 17 years of age and maximum 23 years of age as on December 31st of each academic admission year. The candidate should secure 60% aggregate marks in physics, chemistry, biology, and English. The selection will be based on the rank obtained in the Amrita Entrance Examination Life Sciences, that is AEEL. The counseling will be after the allotment of seats. Uh, the AEL exam is a computerized online exam. The examination centers will be allotted to the candidates. The duration of the exam is 2 hours and the number of questions is 80. Total marks is 240. The syllabus is based on +1 and +2 physics, chemistry, biology, and English. The candidate will score 3 marks for every correct answer, and -1 mark will be deducted for each wrong answer. So when we come to the fee structure, the total first year fee, we have total 3 categories, that is scholarship category, non-scholarship category, and the NRI category. And the total first year fee for scholarship category, that is the merit category, is rupees 2,55,150. And the total first year fee for non-scholarship category is rupees 3,05,150. And total first year fee for NRI category is 4,500 USD. That is the tuition fee. And the other fees and hostel fees is 1,05,150. That is in INR. So the tuition fee for the merit category per year is rupees 1,50,000. For non-scholarship category, the tuition fee is rupees 2 lakhs per year. NRI fee is 4,500 USD per year. And both the other fees and hostel fees are common for all the categories. That is, the other fee is rupees 37,150 per year. Hostel fee is 68,000 per year. So when coming to the registration, we have you can register through website and also through our UG portal. Our portal is Amrita Online Admission Portal, and the URL is applyug.amrita.edu. The website link is www.amrita.edu/admissions. We have a registration fee of rupees 550. And once after the registration, you will get all the updates through registered email and Amrita website. So we have 6 steps for online registration. The first one is register with your email. And the second one is personal information. You can fill your personal details like name, date of birth, etc. And the third one is application. You can submit your application. That is, you can choose your course. If you are willing to opt for BSc Bachelor of Optometry in Kochi campus, you can go to courses, and there will be an option to choose Kochi campus. There are so many campuses there. You can select Kochi campus, and when you choose Kochi, there will be so many courses, like so many allied courses. You can choose optometry from there, and you can click on apply now. And you can the next step is payment. When moving to the payment, there are multiple options for online payment. And you can after the payment, you are directed to the next step, academic details. There you can fill your academic details such as SLC, I mean your 10th details and +2 details. And you are asking to update your 12th status, I mean 12th result status. You can give the status as awaiting. If the candidate is appearing this year, you can fill the detail as 12th result status as awaiting. And the next step is document uploads. You can upload the documents whenever, whatever you have. And if you are waiting for the results, you can upload the +2 documents later. And for all enquiries, you can mail us at ugadmissions@aims.amrita.edu, or you can contact the following numbers. These are the numbers given in our website. And please note that Amrita Vishwavidyapeetham has not appointed any agent or third-party client for securing admission in any program. Students are hereby requested to contact only the toll-free number on our website for any admission-related queries. Thank you. Over to you, ma'am.
Thank you, Aishwarya. So I think you might have now known what the admission process is. Our eligibility criteria, 60% minimum for the aggregate physics, chemistry, biology, and English together. And you have to write the entrance exam. After the entrance exam, within 10 days, there would be the results published. You can log in to get to know your rank, and based on the rank, the students will be selected and will be allotted their provisional admission letter. So I don't see any more doubts over there, and happy that Grishma madam could spend her precious time with us today to explain such a lot of details of optometry and the course. And I'm happy to see so many of you who have joined us together today for this webinar. Hope you have got it cleared why you should join Amrita for the BSc Optometry course. So we expect to see you soon. Best of luck for the entrance exam, Amrita entrance exam, which would be conducted on May 18 and 19. You could attend any one of the days for the exam. So once again, thanking Madam Grishma, Aishwarya, and each one of you who have attended the webinar today. Thank you.